I'm Miss Cindy, so I'm going to be walking you through my 5 milestones of me being an orthopedic elbow surgeon. The doctor I chose to follow is Dr. Kors Shafarnia. He's the chief of Houston Methodist Orthopedics and Sports Medicine at Methodist West Hospital. He's also the team physician for the Houston Texans and the assistant professor of clinical orthopedic surgeon for Houston Methodist Institute for Academic Medicine and Weill Cornell Medical College. He was board certified in 2005 for surgery and 2004 for orthopedic surgery. He also went to medical school in UT San Antonio, which I thought was very cool because it shows that like you don't have to be going to the top schools in the nation to get a good job and to make it to the top of your career. You just have to have drive and motivation to get there. And I chose Dr. Jafarnia because he performed elbow surgery on me in September of 2022. And ever since, I really did fall in love with orthopedic surgery. And I also chose him because he was the first surgeon brave enough to perform the surgery on my elbow since it was so close to my nerve. There was like a risk of paralysis in my left arm. But he did it successfully, and now looking back at it, whenever I go and shadow him, he considers me one of his fun cases. And this is the Houston Medical Center in Houston, Texas, where I do want to eventually work. And it is an ideal location for me because my family is from Houston, so it would be like a 40-minute drive from my hometown, which is right there off like the highway of downtown Houston. And while being in this medical school, it would honestly like really help my career because it is one of the top institutes for orthopedic surgery, and it would also be beneficial because I could live at home so I wouldn't have to pay for rent while paying off my loans from medical school. And the only environmental consideration I have is that Houston is extremely humid, and it's not something that I'm unused to since I'm from there, so it's not really that big of a deal to me. But I do worry about the influx of patients during hurricane season, but like there's two ends to the same coin. Like on one side it's really bad, but on the other side that means lots of patients and lots of surgeries. And the job of chief of orthopedic surgery is currently in existence at the Houston Medical Center, and that's because Houston is a huge metropolitan area, so you do need a lot of professionals there. There's lots of professional athletes, artists, and others all have joint and orthopedic problems. And another reason why Houston is already an occupant of this job is due to the Houston Medical Schools being national leaders in orthopedic education through the use of advanced technology and treatment. And these are more pictures of the medical center. And this is me as a doctor at the medical center once I get there. And my biggest motivator, as mentioned before, was me getting elbow surgery, and that like really set in stone the specialty that I wanted to do, which is hand and elbow. And I really enjoyed this because I didn't really enjoy the surgery, but I enjoyed the recovery in a way because it really like showed me how impactful doctors really are to patients. And like I thank my doctors and my physical therapist for the rest of my life for giving me like my full mobility back. And so I would really want to do that for patients. And the biggest influence in my career choice were definitely my grandparents, as they both suffered from cancer, and unfortunately my grandma passed away from cancer back in 2022. And my grandpa has a spinal fracture along with osteoporosis, which is like the calcification of his muscles and bones. And so these two factors in my life really did lead me to want to pursue medicine, so I wouldn't feel hopeless in helping people, because I did feel really hopeless whenever my grandparents were going through this, and losing my grandma, like it really just set in like a hopelessness that I never want to feel again. Like I never want to feel like I don't know how to help someone. So even if I can't fully cure someone, I at least will know exactly and do like exactly what to do and do everything that I possibly can, and not just sit on the side and watch other people do it for me. And unique abilities that I possess is that I'm extremely determined, because once I found out that women are not really in the orthopedic field, that honestly made my drive to want to be an orthopedic surgeon even bigger, because I'm a firm believer that women can do things just as well as men, if not better. And in my case, I will do it better. And I'm gonna achieve my dream job through resilience and dedication, working through all the good days, especially the bad, especially in undergrad with OChem and everything going on. It's not gonna be easy, but the success is going to be very rewarding when I get to see like the outcome of the patients and like the changes that I did for them. And the second milestone was the interview process. This is me in my little interview outfit. And the interview process felt a little nerve-wracking when we did it in class. However, it was comfortable due to my groupmates making it a safe space. And it was a good balance between professionalism and a good opportunity for me to show my personality. And the process was really engaging, and it also did show me like how prepared I really need to be. Like, you can't just walk into an interview without knowing anything or having prepared some basic questions. As an interviewer, I think there are several areas I can improve on, which would be to ask more open-ended questions instead of short and concise. This allows for more story-based answers instead of short and concise. And I can also focus on the expectations and responsibilities of the role for the job the applicant is applying for. That way the candidate knows what I'm looking for and what is expected, and then they can answer their questions accordingly. As an interviewee, I can improve by maintaining good eye contact with my interviewer, which is something I really do struggle with because this shows confidence and strength in my answers. And I also need to keep in track with the question that is being asked when answering with examples, so I don't lead off the plot and then it just turns into a whole mess. And I see myself preparing more thoughtful answers to commonly asked questions during an interview, as this shows more engagement on my part when it comes to the role, team, and company culture. The next milestone was my derivative problem. In this scenario, I'm an orthopedic surgeon specializing in elbow tendon repair and post-op rehab. I model a patient's degree of elbow flexion regained after surgery with the equation f of x 50 over 1 plus 50 e to the negative 0.25x. X equals the days of physical therapy after surgery, and f of x is the degrees of elbow flexion regained after x amount of days, with a maximum possible improvement of 50 degrees for this patient. Early days are going to produce small gains, and the gains accelerate in the middle phase and then taper off as the patient reaches the 50-degree ceiling. And this is my numeric examples for the elbow recovery. We have 0 days, 10 days, say 30 days, and 60 days. And we have the amount of degrees improving every day. The critical points where f prime of x equals 0 would indicate the local maximum or the plateau. Here, there are no interior critical points. The only meaningful critical consideration is the endpoint behavior. At x equals 0, the patient has an approximate improvement of 0.98 degrees, and as x approaches infinity, f of x equals 50 degrees, which is the horizontal asymptote, because that's the maximum achievable improvement for the patient. And the application is that there is expected continuous improvement, no decreasing, only slowing down as they near the physiological limit. Inflection point is where the concavity changes, where numerically I located an inflection point at approximately x equals 15.6 days, and that f of 15.6 equals 25 degrees. This means that this is the time of the fastest increasing acceleration and recovery. Before 15.6 days, the gains are accelerating, and after 15.6 days, the gains continue to accelerate, but the rate of acceleration decreases. Clinically, this might mark the shift from inflammation-limited progress to strengthening-limiting progress, and this is a useful point to adjust therapy intensity and the types of therapy that you are doing. The graph and how it maps to the field is I plotted f of x for x from 0 to 120 days. The S-shaped logistic curve fits the expected rehab progression. There's very slow initial gain, and then there's rapid movement around the inflection point as the patient is responding well to the therapy, with the gradual plateau as the patient reaches the physiological limit. For the fourth milestone, it was the Riemann sums and fundamental theorem of calculus. Following along with the same scenario as the previous milestone, I'm an orthopedic elbow surgeon tracking a patient's range of motion recovering from elbow surgery, and the rate of improvement in degrees per week over time is modeled by the equation listed. And this is my derivative graph without the Riemann sums table under, which I added in after my initial submission. And I chose to analyze the recovery between week 2 and week 6 because the rate is positive and increasing in that interval. And because the rate is increasing, the left hand sum is going to be the underestimate and the right hand sum is the overestimate. I edited my Riemann sum table to just show the x and f of x values instead of all the additional values that I had provided in my initial submission. The Riemann sums approximate the total range of motion gained using discrete rate samples, while the FTC gives the exact continuous value. In real rehab, the rate data often comes from weekly progress measurements, so the Riemann sums reflect realistic approximations of total improvement. Here we have the right-hand sum, and as you can see, it is overestimates on the derivative graph, and then the left-hand sum shows underestimates. And the FTC shows a true continuous model of total recovery if the rate were perfectly smooth. It uses antiderivatives and gives the precise total change. It is exact and preferred when you have a continuous formula for the rate. And here we show the continuous graph of the recovery for the FTC solid graph. And in this scenario, using discrete weekly measured rates would misestimate the range of motion gain. The average left and right sums improve the estimate here. The exact integral shows the true expected gain of 6.643 degrees in the interval week 2 through 6. And this is me in full physical therapy mode, helping my patients gain mobility. And then for my final milestone was my differential equation for my scenario. In this scenario, I'm an orthopedic surgeon working in the ER when a football player is admitted requiring the surgery to fix his broken humerus, which is this bone right here. I will be measuring the anesthesia buildup in the patient's bloodstream before the surgical orthopedic procedure. When anesthesia is delivered through a continuous IV infusion, the drug enters the bloodstream at a steady rate. At the same time, the patient's body is metabolizing and clearing the anesthesia from the bloodstream. Normally this clearance happens faster when more anesthesia is present, and this is the rate in and out that was based on. The equation is based on the in and out, if that made sense. I don't know. Okay, solving the differential equation, this is my work, and I got the equilibrium of 325 milligrams, which explain the variables is the rate in is 65 milligrams per minute, and the rate out is 0.2 milligrams per minute. The IV pump continuously adds anesthesia to the bloodstream regardless of how much drug is already present. At the same time, the patient's body removes anesthesia proportionally to the amount currently in their system. The constant of 0.2 means that 20% of the circulating anesthesia is cleared out each minute due to metabolism and organ filtration. An equilibrium of 325 milligrams means the infusion rate and the body's clearance rate are perfectly balanced. At this point, the amount of anesthesia in the bloodstream remains constant, producing a stable sedation level, which is what we wanted to achieve, and that's the aim, to keep the patient unconscious but safe during the operation. Running the code, this is the code for the h=2 step size and the graph. And this is the h=4 step size with the graph as well. And the discussion of the results when comparing the Euler's method to the analytical solution for the anesthesia model, both graphs show the anesthesia level increasing rapidly and then leveling off near the 325 milligram equilibrium value. The Euler approximation follows the overall shape of the exact solution, but the accuracy depends on the step size. h=2 provided a much closer approximation than the 4 step size. The h=4 points were more spread out and drifted further from the analytical curve, especially in the later times. As we can see here, they drifted from this analytical curve. And this happens because larger step sizes accumulate more error, while smaller steps track the curve more accurately. The equilibrium is 325 milligrams, which means that this is the level. The infusion rate of 65 milligrams per minute is exactly balanced by the body's clearance of 0.2 milligrams per minute. In terms of anesthesia, this represents the stable sedation level that keeps the patient safely unconscious during the surgery. And my final reflection of the calculus course. And after the process of finding the location of my ideal job, I'm more convinced on what I want to do. Like I said, orthopedics has always been a personal choice for me due to the procedures I have done in the past, and medicine has also been a very personal choice to me. It was amazing to learn that the Houston Medical Center provides exactly what I'm looking for, and it's something close to home with lots of room to grow professionally, which is exactly what I'm looking for. And from the interview process, I learned that an interview is extremely crucial to showcasing who you are as an applicant while also showing your personality and detailing what you can bring to the surgical program. But in order to do this, I have to go really prepared and confident on who I am as a person and applicant, because that's all. It's all or nothing in the interview. And through calculus, I have learned differential equations, rates of change, and equilibriums that can truly be applied to real world scenarios, and I didn't even realize it. Like, I've always thought that. I'm like, oh, how is math going to be applied to my career? And through these examples and applications, I'm like, oh, okay, like, it is important. Like, it is important to know how much anesthesia is going into my patient so I don't kill them. A great example, like I said, is determining the safe anesthesia levels for a patient before surgery. Seeing how Euler's method compares to the analytical solution deepened my understanding of approximation and error being very important, especially in the medical field. This project really enhanced my application of calculus topics through coding and interpretation to support medical decision making. And this is me, graduated and celebrating after surviving the wraths of the chemistry department. And thank you, Miss Cindy, for a wonderful semester.